For more than 60 years, we relied on antibiotics to cure infections without questioning their efficacy. However, we now live in a world where, according to the World Health Organization, WHO, without urgent action, we are heading for a post-antibiotic era in which common infections and minor injuries can once again kill. Antibiotic-resistant bacteria, also called superbugs, represent a growing threat to humankind. They are associated with the overuse and misuse of antibiotics. There is a lack of accurate diagnostic testing that can rapidly detect the presence of respiratory tract pathogens. Such a test would help slacken superbugs, as respiratory tract infections are one of the major infectious diseases associated with the unnecessary prescribing of antibiotics. To help address the health issue of superbugs, the European Commission funded the DIAGORAS Project. This project gathers 10 partners from 8 European countries, received a grant of €5.6 million, started in June 2015 and will last 4 years. A DIAGORAS chairside and rapid diagnostic device for respiratory tract infections will have been developed. This DIAGORAS device will help reduce the burden of superbugs on global healthcare systems and improve quality of life worldwide. To understand how the DIAGORAS project can help the general practitioners, we invited Dr. Royce Elshout, a specialist in family doctor practices and childcare, to give his opinion on this innovative device. Between 2013 and 2017, more than $1.8 billion were granted to the research to solve the threat presented by antimicrobial resistance. However, more bacteria are becoming resistant to many different types of antibiotics. Why?
There are various factors related to antimicrobial resistance, and a major factor is the overuse and misuse of antibiotics in medical care. And it's especially important to focus on primary care because most antibiotics are prescribed in primary care. For instance, in the Netherlands, about 3/4 of all antibiotics are prescribed by general practitioners. And the most common infection we see in primary care are respiratory tract infections, and we know that most of those infections are caused by viruses, and antibiotics just don't work for them. However, it's really difficult to find out whether an infection is caused by a virus or a bacteria, so it's difficult for the GP to decide whether to prescribe antibiotics or not.
How do you diagnose respiratory tract infections, and how do you decide when an analysis is required?
Respiratory tract infections are diagnosed based on patient history and physical examination, and we only do additional analysis when we are in doubt about the diagnosis or about the severity or cause of the disease.
Do you have any tool in your practice to identify the cause of these infections?
In my practice, I can measure the inflammatory marker C-reactive protein, also called CRP, and I can do it point of care. However, it has only limited value in discriminating between a bacterial and a viral infection, because there's a substantial gray area of CRP values that are inconclusive in terms of further medical management, which is ultimately whether to prescribe antibiotics or not.
If you had a device like the one developed by the DIAGORAS Project, what could it allow you to do for your patients in your family practice?
In my practice, such a device may help me to determine from a broad range of viruses and bacteria which is the cause of the respiratory tract infection in my patient. Therefore, I can treat only the patients with a bacterial infection and not treat the patients with a viral infection. And this may ultimately lead to less antibiotic prescriptions. And this all can be done point of care and within 1 hour.
You are a member of the DIAGORAS Consortium. Can you tell us more about your role in the DIAGORAS project?
I'm an advisor in the DIAGORAS Consortium. As a potential end user, I can tell the partners which specifications are needed to make sure that the device is helpful in future patient care.
The DIAGORAS Project aims at developing a device and a lab on a disc, the respiratory disc, which will be able to identify a wide range of pathogens, viruses and bacteria involved in respiratory tract infections. During the appointment with the patient, the practitioner will use the device developed by DIAGORAS to help make a clinical evidence-based diagnosis. To ease the work done by the practitioner, the swabs are analyzed at the point of care. The respiratory disc will analyze and measure the pathogen's population in the sample. The results will start being obtained within an hour, speeding up the actual process of diagnosis. The platform will allow the timely, on-site and evidence-based prescription of personalized treatment procedures. We all need to take action to help prevent the worldwide spread of superbugs before they move us backwards to a time when infections had no cure. The DIAGORAS Project partners are hoping to bring the world a device that will help put an end to the spread of superbugs. To follow the progress and results of the DIAGORAS Project, please visit our website at www.diagoras.eu.